Pam Getzey, president of Vermont Blue Advantage, and I'm here with Dr. Thomas Petroff, the Vermont Blue Advantage's corporate medical director. Dr. Petroff, so glad to have you here today. I'd love to talk to you about how we could keep Vermonters healthy and strong during this challenging time.
Thank you, Pam. I'm happy to be here and happy to chat. And I too agree with you that it's very important that we have a discussion and really try and get appropriate information in front of our members.
Thank you. Can you give us an update as to the COVID-19 status in Vermont today?
Sure. As of noon yesterday, this is the most recently published data, there were 68 new cases with a total of 4,172 diagnosed. Currently, 21 are in the hospital, 5 are in the ICU, and 4 are under investigation that are hospitalized. So the percent positive rate is 1.6%, which actually puts Vermont in one of the lower states as it relates to exposure to COVID and COVID positivity. So that's really great news. It shows that Vermonters are doing the right thing. They're wearing the mask, they're practicing social distancing, not having mass gatherings. So kudos, and it's very important that we continue this same approach.
Okay. What have been some of the most effective measures to keep the spread at bay, and what could we do as a community?
I think the single most important thing is if you're sick, don't go out. It's best to self-isolate as much as possible, understanding it's important if you do go out to wear a mask. And it should be a mask that covers both your nose and your mouth, and move away from the gaiters. Those they're not as effective as a regular surgical mask or an N95 mask. So I would especially recommend that for individuals that have chronic conditions and are elderly. It's very important.
Okay, that makes a lot of sense. And what do you think Vermonters' greatest concerns are regarding the virus? And what are some of the things we still don't know about transmission and the lingering symptoms?
Yeah, I think one of the biggest things is trying to get an understanding of how long, say, droplets from a sneeze or a cough last on a surface, or the ability for that transfer to cause a COVID infection. I think that's something that we don't necessarily have a great understanding. I think the other thing is we've got the flu season has started. Right now, the early data is actually good in that it doesn't appear like it's very widespread like it has been the last few years. But it's still very important that we make sure that Vermonters are immunized and make sure that when the COVID vaccine is released, that again, especially those at risk and first responders are immunized as quickly as possible. I think some of the unusual things that we are seeing with COVID that we haven't really got a great understanding on are some of the symptoms that are very particular to this infection, including the loss of taste and smell. And there appears to be some possibility of lingering lung damage and even neurological damage, depending on the severity of the illness. So these things are just becoming clear as it relates to trends in the medical literature. And we still don't know what it means or whether it will correct over time.
Good. Yeah, lots of uncertainty there.
Mm-hmm.
Yes, I'm curious what you think people's understanding is regarding insurance benefits related to COVID, and any thoughts on how our Medicare Advantage plans address COVID-19 coverage?
So we as a Medicare Advantage plan, we cover COVID-related illnesses and treatments that are approved. And also we cover for the flu vaccine, we cover for that for the regular flu shot. And we will be covering the COVID vaccine when it does get approved. So I think the things that we are going to see as it relates to the delivery of healthcare that are going to change is I think that the whole concept of a video medicine, if you will, is going to stick around even after the COVID crisis. The best estimates are about 25% of all visits on a go forward will be via video, and that's actually a good thing. It's great that we're able to leverage privacy protected video conferencing, and it does make a lot of sense. And I think that's one of the, I hate to say the good things that have come out of it, but in times of crisis, oftentimes we see that technology evolves very quickly, and I think that's something that we need to take advantage of. And certainly, as a Medicare Advantage plan, we're very supportive of that, and will continue to be supportive of that in the future.
Yeah. Yeah, it's a great technology and convenient, and lots of benefits there. So as the holidays are approaching, what are your thoughts on how to stay safe, and thoughts on travel and family gatherings?
Mm-hmm. I think the most important thing is to really get your information from a trusted source. So whether that's the CDC website, or Vermont has an excellent website with great information from the Department of Health and Human Services. And I think, first start off with information that's trusted, and then go from there. I think right now, as it relates to Vermont in particular, there are restrictions for travel in place, and then quarantine for non-essential travel. So that really covers a lot of sort of the Christmas gathering approach in Vermont, and really it's probably best to avoid, again, large gatherings. And certainly if there are gatherings where the individuals that are gathering have compromised health, and also in settings where if you're sick, you really shouldn't be going.
That makes a lot of sense. Well, thank you, Dr. Petroff. I greatly appreciate you sharing your insights with us today, and I wish you well.
Thank you, and same to you. Stay safe and be healthy.
Thank you.